Thailand's Prime Minister has stated that if COVID counts continue in their slowdown, as they have in the past while, a review at the end of the month could lead to relaxation of restrictions as early as February. He also confirmed that the AstraZeneca vaccine purchased by the government stands to receive full approval for use by the end of this week. Good news then, as many regions saw a splurge in cases, many derived from travellers from Samut Sakhon, and subsequent quick drops. Zones will also be due for evaluation, and it's hoped that regions like our own Chonburi province will see changes to its status too. The simple allowance of interprovincial travel and sale of alcohol on site in clubs, bars and restaurants would see a significant pickup for cities such as Pattaya for sure. Tuesday saw just 171 new COVID cases, no deaths, and areas of serious concern only in Samut Sakhon and the capital Bangkok. The worry then would be that Bangkokians, if allowed to travel to resort areas, could carry the virus with them. As we've seen before, it only takes a handful of COVID-positive people, often asymptomatic, to cause a cluster. Applications for visas and extensions of stay for people already in Thailand got some clarity yesterday following changes to the Immigration Act that saw COVID added to the list of diseases of concern, and was followed by statements from social media posters that applicants would need to prove COVID testing as a part of their application. As we said, it read that way, and still does. However, according to Khao Sot and other legitimate sources, an immigration police spokesman yesterday said that it will only apply to certain types of visas, perhaps the permanent residence visa, and for certain new applications from outside the country. Immigration, we're told, is waiting for full clarification from the Council of State, and it's been confirmed that in Chonburi it's not a requirement for visa applicants currently, with similar reports from other provinces too. Will that change? Possibly. It all depends on how the law is affected, and also on the use of the Thai original wording and not translations. Leaving it on the statute books means that it is and always will be an option if required and needed. With the issue of employers taking on illegal immigrant workers now very high on agendas in the government, the other main cause of disease spread has been highlighted over the past few weeks: illegal gambling dens. The number of reported pop-up casinos has been staggering, for some, and yesterday saw a raid on a storage facility that supplied slot machines to those very dens. A massive 418 machines were discovered during a raid on a warehouse and are believed to belong to a gambling organisation based in Chonburi and rented out to anyone who wanted them. It's assumed that many more are already out on loan, and another 180 machines sourced from Chonburi too were found recently in a raid in Sakau. Meanwhile at home, and the mood here is pensive following the Prime Minister's remarks on regional reviews. With most business shutters still down in the city and the local economy non-existent, any move that allows a slight and perhaps staggered revival will be welcome. And with the reminder mitts, masks and meters, wash your hands, wear a mask and keep social distancing, and the Met Office promising highs today of 31 dropping down to 21, a sunny but hazy day. That is the local and national news from Fab FM. For videos and of course to keep up with fabulous Pattaya, visit alwayspattaya.com.